Hi everyone, my name is Abigail Ingram and I'm currently a medical office admin student here at Seneca College. I'm currently preparing for my placement in a healthcare setting, most likely in a hospital clinic or a medical office environment. One reason that I chose medical office admin is because I really enjoy helping people and being part of a team that supports patients and works together. I think medical office administrators play a really important role in making patients feel comfortable, safe, and supported. A medical admin professional has so many responsibilities in healthcare, including answering phones, booking appointments, greeting patients, uploading medical records, and communicating professionally with all patients and as well as staff. Even though medical office administrators don't deal directly with the patient and hands-on medically, they play a really big role in patient care. They are usually one of the first people that speaks to the patients within the clinic or the office or whatever it is. So being welcoming and organized and professional is really important. Administrative staff also keeps clinics efficient, organized, and especially when things are going off the wall and super crazy and busy in there. Confidentiality and professionalism is also very important in healthcare environments. Patients trust the healthcare workers with private and personal information, so it's important that we keep that confidential and to ourselves. Professionalism also means staying respectful, calm under pressure, not freaking out, not getting too stressed in front of patients, dressing appropriately, and communicating clearly with patients and all staff. For the patient interaction section, I chose option A, which is a patient who is upset about a long wait time, which is a pretty common thing to have happen. If this situation happened and I was present, I would just stay calm, professional, and I would be very understanding. I would speak respectfully and try to acknowledge the patient's frustration and just, yeah, be very understanding without being defensive or getting my back up or anything like that. I would say something along the lines of, I understand the wait is very frustrating, and I really appreciate that you're being patient. The healthcare system is doing their best to help everyone get through quickly as possible, but let me see if I can get an update on how long it will be for you. I think it's really important to stay calm in these situations because patients are already feeling stressed and worried or not feeling well or have something going on. So staying professional and understanding can help just de-escalate the situation and make the patient feel really heard. I would also make sure patient privacy is protected by not discussing any personal medical information with them or any symptoms, all that stuff, because that's just not my place. That's for the doctor or the nurse to handle, especially in a public area. And if needed, I would also get more assistance, maybe from a manager or a staff member, if it gets out of hand. For the placement readiness reflection, two strengths I believe that I bring to placement are communication and organization. I work really well with others and I also keep a really positive attitude about things. And I try to communicate professionally. I'm able to dress professionally and also privacy and everything. I'm really good at maintaining that as well. I also really enjoy staying organized in lots of aspects of my life, but especially within work. And I like to make sure that tasks are completed on a priority basis. So what needs to be done first is the most important. One area that I would like to improve in is being a little bit more confident through hands-on experience in a healthcare setting. So I think that with an opportunity of a placement, I would be able to shadow people and see kind of what is expected of me and then be able to try it myself. And I think that's an awesome way to learn. Um, yeah. So to remain professional during stressful and difficult situations, I would plan to stay calm and focus on problem solving, but as well keeping the priority of what needs to be done um, right now, what needs to be done first, and then maybe make a list and check it off as I go. I also want to continue learning from feedback and experience throughout my placement, so it would be really helpful if I can get some criticism on what I'm doing right, what I'm not doing, some feedback, so that I can only improve with what I'm doing. And I think that would really benefit me for the workforce. And as I move into a job, it would help me go in confident and just feel a lot more prepared. And of course, you're going in with um, little experience, just with school and a placement. But I find that the more you do things, the more confident you get, and the more you are um, able to put in action what you're learning. And I think that will really help with our placement. But overall, I'm really excited for my placement because it's going to allow me to apply